Hello friends, I am Dr Vimee Bindra, gynecologist and the laparoscopic surgeons at Apollo Hospitals, Hyderabad. Today we will be discussing about a very common disorder which young women are suffering nowadays called as Polycystic Ovarian Syndrome, or commonly known as PCOS or PCOD. So let me first explain to you what PCOS is. Polycystic ovarian syndrome is a symptom complex in which a woman may present with irregular periods, she may present with acne or excessive hair growth on the body, or presence of polycystic ovaries on ultrasound. So according to Rotterdam criteria, we diagnose PCOS if any of these two features are present in a woman. So if a woman presents with irregular periods and also with excessive hair growth on the body, we can tell her that she is having PCOS even if the scan is not done. So clinically also we can diagnose if two of the features are present in her. So what causes PCOS? The exact cause of PCOS is still not known, but a lot of factors may be contributed towards the development of PCOS, such as insulin resistance, lifestyle factors, weight gain, dietary habits, and increased androgen levels in the body. Usually in a natural cycle, what happens is an egg is produced in the middle of the cycle, and if the pregnancy is not there, there is a shedding of the endometrium in the form of menstrual cycle. So in PCOS patients, because of insulin resistance and different hormonal changes, the ovulation does not happen. So the structure which produces the egg, called as follicle, they do not become dominant and they can be seen as a small fluid-filled spaces on ultrasound. That is why the name has been given polycystic ovary. So having a cyst in the ovary and having a polycystic ovary are two different clinical entities. Many patients come to us saying that I have a cyst in the ovary and I need a surgery. So polycystic ovary does not need surgery at the first instance. It is usually a medical management for polycystic ovarian syndrome. What are the common symptoms with which women come to us? They come to us with weight gain. 80% of PCOS women are obese. They come to us with scanty periods or irregular periods. They come to us with infertility. They may have acne after adolescence which are not responding to the dermatological treatments. They may have excessive hair growth on the body parts like the lips, chin, other areas of the body. They may present with hair loss. Apart from this, they may have mood disorders, mood swings, depression, anxiety. Their blood sugars may be elevated. They are having high insulin resistance. They may have thickening of the skin at the nape of the neck called as acanthosis nigricans. We have already discussed how we can diagnose PCOS by the clinical features and also by the ultrasound findings. Now, how do we treat this disorder? Catching them young is the idea behind creating awareness. The earlier it is diagnosed, the earlier measures are taken, PCOS can be kept under control. If you ask me, is there a cure for PCOS? I would say no. PCOS cannot be cured. It is like diabetes and hypertension. It can be kept under control by lifestyle changes, dietary changes, and through few medications, but we cannot completely eliminate it from the body. So first and foremost, treatment for PCOS is diet and lifestyle changes. The diet is less carbohydrate diet. Foods with low glycemic index should be used, and exercise, moderate to severe exercise, does help in reducing the insulin resistance. The treatment is symptom based. If a patient needs regularization of the cycles, they are given birth control pills with estrogen and anti-androgen. Treatment may be directed at acne and excessive hair. If patient is looking for pregnancy, so ovulation induction is the first line of treatment because these women are not ovulating. So we have to give some medications to help them ovulate. And the success rate of PCOS infertilities are very good because the only problem with them is ovulation. So once the ovulation induction is started, along with lifestyle and dietary changes, the success rates of pregnancies are very good. These patients are also at risk for long-term problems such as type 2 diabetes mellitus, metabolic syndrome, and cardiovascular diseases. As these patients have infrequent periods, they bleed once in 2 to 3 months, there are chances of endometrial thickening or endometrial hyperplasia. So there is also a risk for endometrial cancer in the later life. So I would advise, take care of yourself. If you have been suffering from irregular periods, weight gain, excessive hairs on any part of the body, or acne not being treated with the other medications, do see a gynecologist. You may be suffering from PCOS, and yes, believe me, it can be controlled and you can live a normal life. Thank you.
If you want to know more about PCOS, please read my book on A to Z of PCOS. It is available on all major e-websites like Amazon, Flipkart. Also, Kindle edition is available. Thank you.